everyone. This is Tosha, and you're tuning into the Super Nova Tosha Show podcast, the show that addresses social issues and how it affects our community. And today's show, we are going to be talking about maternity medicine when it goes wrong. So, maternal mortality and injury rates disproportionately affects Black females regardless of income level. Statistics show that Black women are 3 to 4 times more likely to die from pregnancy-related complications and experience severe disabilities resulting from childbirth compared to white women. Black women also face disparities in infertility rates, stigmatization, and access to fertility care. Studies indicate that fertility affects at least 12% of women of childbearing age, with the number doubling for Black women in the United States. This is a very real crisis for Black women in the healthcare system. And I must warn you that this is going to be a very tough subject. So if you've ever suffered the loss of a child, a miscarriage, ectopic pregnancy, multiple miscarriages, or just problems, issues arising from getting pregnant. If you have infertility issues, I have to tell you, I'm going to warn you now, this is a very, very touchy subject. It took me a while to, do this one because I myself suffered an ectopic pregnancy and lost my first child. So I just wanted to make sure that I put it out there that this is a very tough subject, okay? So, moving forward, Black women in the United States, this is a very real crisis. And I just want to say that there is a lawsuit that was filed alleging that a doctor used excessive force and decapitated a Georgia woman's baby. The parents are Jessica Ross and Trayvon Isaiah Taylor Sr. So they attended a news conference in Atlanta where the attorneys for the couple announced that they're going to take legal action against Dr. Tracy St. Julian and the Southern Regional Medical Center, the hospital in Riverdale, Georgia, where the incident occurred. This happened in July 9th, I believe it's 2023. The attorney, Corey Lynch, stated that the couple's excitement for the birth of their first child turned into a nightmare that was allegedly covered up by Southern Regional Medical Center. So I have a clip of the attorney and just some of the things that took place. We're going to go ahead and roll that video. Please take a look.
It was supposed to be a day of joy. July 9th, Jessica Ross went into labor hoping to welcome her first child.
Their dreams and hopes turned into a nightmare that was covered up by Southern Regional Medical Center.
A lawsuit filed Wednesday morning alleges the baby got stuck during labor. And despite signs of distress, Dr. Tracy St. Julian continued to try and pull the baby out.
The clear and obvious answer is to perform a C-section. This is what's done all the time. And that was not done in this case, and it should have been.
Susan Witt is a medical malpractice attorney who examined the case for us, which claims that when the doctors finally did perform a C-section hours later, they found the baby decapitated.
I have never heard of a situation where the result has been a decapitation.
Instead of telling the couple, the lawsuit says doctors tried to cover up what happened, telling them that they didn't have a right to a free autopsy, encouraging cremation, and even concealing what happened when they asked to see the body.
When they wrapped this baby up tightly, they propped the baby's head up on top of the blanket to make it appear as though the head was actually attached when it wasn't.
That is an attempt to defraud and deceive the family.
The family says it wasn't until a funeral home raised the red flag that the parents would learn the truth. 4 days after she first went into labor.
I think this is one of the most outrageous situations that I've ever seen in my 25 years of practicing law.
Michael Doudna, Channel 2 Action News this morning.
And that attorney is correct. This has got to be one of the most outrageous occurrences that I've ever heard of, ever. This is egregious and absolutely outrageous. Not only, what happened, but the fact that now you're going to cover up what happened to this couple's babies. And I know that there are couples that have actually held the deceased baby and, were able to have a funeral, but to even suggest and encourage them to not have an autopsy and just, cremate the baby. I think that is the most egregious portion of this. It's absolutely heinous. So approximately 3 hours elapsed before Dr. St. Julian performed a C-section on the mother, Ms. Ross. As stated in the lawsuit, at that point, a fetal monitor had ceased registering a heartbeat. The cesarean section resulted in the removal of the baby's legs and body, with the head being delivered vaginally, according to Edmond. The couple had requested a C-section earlier when the baby could have potentially survived, but the request was reportedly denied. The lack of compassion, sensitivity, and professionalism and human touch in this situation is deeply concerning and absolutely unacceptable. And I'm not particularly focusing solely on Atlanta's Black doctors, but it just appears that this city has a significant number of Black physicians. But, if you watch Bravo's TV's Married to Medicine, you may be familiar with Dr. Jackie. Dr. Jackie, she made a live video, I believe this is in 2020, suggesting that Black women can be dramatic and tend to complain excessively in order to take time off work. And again, big ups to the city of Atlanta for having so many Black doctors, and big ups to Black doctors themselves. We need more, especially to care for us. There's certain specific needs that they understand. So we're not going to have like a handful or a few bad apples spoil it for the majority. So I'd love for you all to, okay, so here's the thing. Like, I'm not going to play with your emotions, right? I'm not going to play in your face. I'm not going to play with your emotions. But when I heard that she made this statement and a lot of people were just dragging her, I thought it was just something that was made up. I thought I would never think that such a professional woman, because honestly, I don't watch the show, but I've seen a couple episodes of it, and she was actually my favorite character. So when I heard that she made the statement, of course, I didn't believe it. And then, of course, me doing my research. Now, unless this is, not a real video, this is what I came up with. So I just want you to go ahead and take a look and listen to this video of Dr. Jackie speaking with one of her co-workers, or I forgot her name. She's a dentist also in the same show, Married to Medicine, as they have this conversation. So I'm going to go ahead and roll that video so you can look and listen for yourselves.
Doctor, and not women, we're a bit more dramatic, and that you go to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
That ain't me, boo. I don't know what you're talking about, but go ahead.
I didn't say you. I just said as African American women, we want to also make sure you're being serious with your doctor and not playing the game so I can take you off work. Because then we see you 25 times in the pregnancy. It's hard to believe that there's a true problem when there's a true problem.
Ooh, baby, this.
Okay, so I think I'm going to include myself because I'm also a patient, but we as patients, we may benefit from receiving medical training. We may as well take a couple of classes in phlebotomy and maybe medical billing and coding. Not that we're going to work in the field, but just educate ourselves and advocate for ourselves because, some health insurance training, some maybe take a course in CNA or medical assistant training, just so we can, you know, um, advocate for ourselves because, we need to effectively advocate for ourselves and ensure that we are receiving quality care if this is what we're going to have to deal with. And yeah. So I'm going to share with you just a little story why I feel so passionate about this. I'm, in my 30s, which is considered relatively advanced for childbearing in by American standards. I found myself facing the label of geriatric pregnancy due to my age. So, I was in my 30s, early 30s, and this coupled with pre-existing health conditions categorized me as a high-risk individual during this significant life event, gonna have a baby. So during a routine checkup at a large medical practice, I went to I had a large medical practice is where I attended, and I encountered a situation with a substitute doctor in the absence of my regular physician. So I had an appointment scheduled because the closer I came to giving birth, when you're high risk, you have to go in and see the doctors more often. You have to go get like fetal monitor. It's a whole thing. So my regular doctor wasn't able to see me, so I saw a substitute physician. Approximately, I think I was either like 36, 37 weeks along. And I was experiencing some, discomfort, sleep deprivation, swollen ankles, and the added stress of managing insulin injections in my stomach. So, every day I was, giving myself insulin in my stomach. Additionally, I had high blood pressure, and it was gradually increasing. So, given these circumstances and my proximity to delivery, I requested that the doctor consider taking me out of work due to my deteriorating health condition. I just was not feeling well. I was fatigued. Just to walk down the hallway at work, it was a chore. And so, during this consultation with this doctor, I shared my apprehensions and concerns as a first-time mom who had, previously experienced a loss of a child. And if you've ever experienced a loss of a child, it's absolutely devastating. First of all, I mean, this is some years ago, but I think you just don't even really recover from it. You move on with life, and then you focus on the children that you do have. And so, given my cautious approach to any potential issues during pregnancy, I regularly consulted my doctor, and I purchased about 15 books about babies and pregnancies. And it was funny because my mom was like, by the time you give birth, you could be a doula, you could be like a midwife because you know so much. So subsequently, my doctor had scheduled a C-section at about 39 weeks because they were projecting that maybe the baby would be larger than usual, and due to concerns about shoulder is it diastosia, shoulder diastosia, a condition where the baby's shoulders become stuck during delivery. So when you're having a vaginal delivery, sometimes the baby's shoulders can be stuck, particularly common in infants of diabetic moms who tend to have larger babies. And I think with Miss Ross' situation, that may have been what caused the baby to be stuck. So my doctor was already alerted me to it, and I have to say I had such a wonderful doctor. She had moved away right after I gave birth, but she was a wonderful doctor, and even being coined geriatric pregnancy. She even had asked me to take an amniocentesis. And I was like, why? She's like, because of your age, you could have, maybe you could give birth to a baby with a Down syndrome or other defects. And I said, listen, I'm not going to do that. I'm like, I could be a chance of a miscarriage. She said, absolutely. Yes. If we, stick the needle to take out fluid to test it, sometimes the needle will pop the second baby and then you'll miscarry. I said, you know what? I'm not going to take that chance. My baby comes. That's just what I have to deal with. And she said, well, I mean, if you have a special needs child, don't you want time? I said, no. They do back in the day. We just dealt with it. About if I want to have the amniocentesis, if I want to find out all these things, and she just really laid everything out for me. In fact, the hospital that she wanted me to give birth, I was like, I absolutely despise that hospital. I don't want to go there. I want to go to this other hospital that's like super posh, and and she looks at me and she says to me, I want you to know that you are giving birth. You're not going to the Ritz Carlton. You're not going on vacation. You are giving birth. You, given your high risk, you don't want to be at a posh, beautiful hospital where they're giving out lobster dinners and baskets. If, God forbid, something's wrong with your child, you want to be at the best hospital for newborns. And oh gosh, I loved her. So she really broke everything down and really gave me caution and put me in the right mindset where I needed to be, as far as educating me with complications, what could go wrong, where I needed to be. She was awesome. So, of course, I was disappointed that I wasn't able to have my appointment with her, but I had a substitute doctor. And so, I'm there at my appointment with this substitute doctor, and I tell him my concerns, and he says to me, or better yet, tries to mansplain that there's absolutely nothing wrong with me. I am just pregnant, and that's what happens. When you're pregnant, you get swollen ankles, and you're pregnant. Um, but then, he tells me, in fact, I want you to follow me. So I hop off the examining table and I wobble behind him. And as he's walking, leading me down the corridor to the lobby area, there's a pregnant staff member. And he told her to stand up. So she stands up and he says, look, she's also pregnant and she's here and she's at work. Right. So I told him, I said, listen, we are two different women and we are experiencing two different pregnancies. And seeing as though you're not my regular doctor, I am not going to continue this conversation. So I gave him my back and I turned to, one of the receptionists and, I had them make an appointment with my regular doctor as quickly as possible. So I come to my appointment to see my regular doctor, and she looks at me and, she's asking me all these questions. And of course, I tell her about my concerns. She looks at my swollen ankles. She's noting that I have some swelling in my hands. She noticed that my blood pressure has gone up. And she says to me, you know what? I'm concerned about you having preeclampsia. So let me just say that preeclampsia, it's a very, very serious issue. It increases your blood pressure, and it can actually stress your heart, which can cause problems during pregnancies. So here I am at the same practice, right, but two different doctors, and of course two different plan of care. So immediately she writes on her prescription pad, I want you out of work. You need to be out of work ASAP. Do not return. And that's it. Now, had I not sought a second opinion and advocated for myself, there's no telling what the outcome would have been. I could have gone back to work like this other doctor suggested, that everything's fine, you're fine, nothing's wrong with you. And, gone back to work and ended up with preeclampsia. And there's no telling what could have happened. So I share this very intimate story with everyone, that whenever you feel that you're not being heard, whenever you feel that your doctors just aren't listening to you, and you feel that something is wrong, you know how your body is, you know how you feel, you know how you're supposed to feel, you know you more than anybody else, more than what any tests can show, more than what any doctors can say to you. Oh, this is normal. I did this test and that test and that test, and everything came out normal. There's nothing wrong with you. Nothing's indicating that there's an issue. If you know that you're not feeling how you're supposed to feel, you have to take second opinions. And I've had people say to me that they didn't want to offend their doctors. Offend your doctor. Offend that doctor, please, because at the end of the day, it is your health, it is your life. And at the end of the day, it doesn't just affect you, it affects your entire family. It affects your household. It affects everyone around you. So do your best and advocate for yourself. That's the very best advice that I can give you, that I can say to you, that you need to just advocate for yourself, because the way that these doctors are running nowadays, I don't know. It's rather scary out there. So let's just say that the disparities for medical care for Black women in America, it's significant, and it's multifaceted, and it's affecting overall health outcomes, especially for Black women. I have to say it, I can't stress it enough. Black women face higher rates of maternal mortality, chronic illness, and poor access to quality health care compared to our white counterparts. Um, Even, I don't remember her name, but she does play a TV judge. I mean, she's a judge in real life, but um, her daughter-in-law, just right after giving birth to um, the grandchild, daughter-in-law passed away. And so, her son is now a widower, and you have a baby who is motherless. So even with money, so I can just imagine when you don't have money, and just all kinds of weird things happened to me during that time too, because I had really good health insurance. I have to say, I'm just throw this in. I had really good health insurance, and then with that hospital, there was a section for moms that are on welfare, and there's a section for when you have private insurance. And I remember doing the hospital tour, and they were showing you, if you're on government assistance, you get to share a room, and you have a small room. But when you have private insurance, you get this big, huge room. And for me, my whole concern was, I just don't want to be here. I want to have my baby. I want to get out. I could care less about my room. Like, I just want to get out. I want to have my baby. I want to go home. I'm not going to be comfortable if I'm in a big room. I will be comfortable in my own house. And I remember getting brought into the room, and my mom was accompanying us. There was my mom, and then one nurse with the baby, and the other nurse pushing me in the wheelchair. And one of the nurses actually was like, she doesn't go here, she goes there. And it was the other nurse that said, no, she doesn't. I think she just assumed, because of the color of my skin, that I was a Medicaid mom. And there's nothing wrong with being on Medicaid, because you need help, you need help. That's it. But I had really good insurance, and so the other nurse was saying, no, she does not. That's not where she goes. And then I could just see, like, my mom, like, smoke coming out of her ears. She was getting so irate, and she was like, I know what she was assuming. I know what she was assuming. And I was like, you know what? I really just want to go home. I don't want to be here. I don't care. Just make sure the baby's okay, make sure I'm okay, and I really just want to go home. So, again, Black women face higher rates of maternal mortality, chronic illness, poor access to quality health care, and these disparities are further exacerbated by the inadequate prenatal care, misdiagnosis, and under treatment of medical conditions. I cannot stress that enough. So, yes, this was a very tough subject to deal with, but again, these are all social issues and they all impact our community. And we may not come up with a resolution, in one show, but my sole purpose is to have conversations, have these tough conversations. So when we vote, these are things that we're looking for people who represent us, and we have to start with the small to the large. And with the election coming up this year, you just don't even know who to vote for, because you got the Roe versus Wade and all this stuff. We also have to take into consideration all the other social issues that impact us. So I would love it if you would just have conversations and just share. The Supernova Show podcast definitely can be heard on all your apps, your Spotify apps, your Pandora apps, your TuneIn, iHeartRadio. Even I listen to my show sometimes on Alexa. I just say, Alexa, play the Supernova Tosha Show podcast, and while I'm doing my chores or what have you. So if you do have access to an Alexa, just go ahead and listen to it, tune in, and share. Tell other people about it. I have so many various show subjects that I discuss. And the goal for me is to be on the top 10 podcast list to listen to. So please share and subscribe to this YouTube channel and spread the word. I am absolutely grateful for your time. I want to thank you so much for being attentive. I appreciate your presence.